Hi, this is your second video lecture for Module 5.1. The next thing I'm going to be talking about is the differences between postpartum depression and baby blues. Okay, and some of the thing is, and I believe this is in your PowerPoint that I gave you, but the baby blues is about 75 to 80% of women experience this kind of like depression type thing after probably like day 5 through day 10, okay? It is linked to just a lot of hormonal changes, but the thing is that some of the things that we can do with that is that, sleep when the baby sleeps, take time for yourself, plan a day out of the house without the baby, communicate with people that are in your inner circle about what's going on, that you just need a break for a minute. And if breastfeeding, allow time to learn, because what I tell all my patients in labor and delivery is that if you are committed to breastfeeding, it's going to take a good month before it really, really, truly works, okay? Of the women that have these baby blues, and I believe there's a YouTube video on this too, so make sure you look at that, okay? Postpartum depression is pretty serious, okay? About 10 to 15% of deliveries end up with postpartum depression. And what's really sad is that there's so many that go undetected, okay? It can happen within days of birth or appear, just gradually as the year goes on. They're very similar to non-postpartum mood disorders, but there's a lot of screening tools that we use in the hospitals that you could utilize and look at that. Women often respond well to pharmacological treatment, which is really cool. And there are support groups, okay? So just make sure you know the difference between baby blues as well as postpartum depression. Some of the interventions that we do in postpartum is, comfort, and we teach. This is the perfect opportunity to teach our patients about self-care as well as newborn care. And there's just so many things that we can teach them, okay? But as far as comfort, rest, exercise, we want to make sure that we're, telling them to wear a bra or telling them to wear a binder, to sleep when the baby's sleeping, maybe get up and start walking a little bit too. Good nutrition and emptying that bladder and having bowel movement as soon as possible. Dermaplast is that lidocaine spray. The Tux pads that we've already talked about are things that we use. And probably the big thing too is when we are teaching our patients to take care of themselves, is that we want to prevent infection, especially if they had any type of like episiotomy, a laceration, a C-section. You're looking for signs of endometriitis, which is the infection inside, and a lot of times that happens when we have a C-section or if somebody has been had ruptured membranes for a while. Okay, so making sure that we teach our moms about a sepsis, a proper perineal hygiene. That we have those bottles that you kind of like just squirt, and that so you're not rubbing like toilet paper and things like that. Okay. So some of the sources of infection for postpartum women would be like the breast, with that's mastitis, which is usually unilateral. The uterus, which is an open wound from delivery. UTI, or any type of wound, just from like the episiotomy. Okay. As far as just really quick, making sure that remember, ROGAM is something that we do in postpartum within 72 hours after delivery. If a mom has a negative or a non-reactive rubella, or it's equivocal, we need to give that to her before she goes home as well. We want to encourage bonding with our parents, our moms, our dads, our significant others. Baby actually uses all their senses, okay? There's those paternal tasks that you need to maybe just take a look at that in your book. Expectations and reality is two different things. And then the other thing that you need to know is about Rubin's stage, the taking in, taking hold, and letting go. Taking in is all about mom. It's that first 24 to 48 hours where, she's very dependent. She needs to talk about her birth experience. And then taking hold is where the mom starts to kind of like start taking care of things, okay? She's a little bit more independent. She's a little nervous, but she's really good. And teaching is a great time during this stage. And then letting go is just letting go of that former life. Okay, if you wanted a boy and you got a girl, a vaginal delivery turned into a C-section. There's just some failed expectations that you just have to deal with. Okay, age and social support those BIPSity factors that we talk about, they all take precedence during this time, okay? You know, there's a difference between a 14-year-old having a baby and a 34-year-old married woman having a baby, okay? Knowing who our support people are, okay? And then how is the baby? You know, is it healthy, ill? That's all going to play a role on how our parents' task of parenting goes. Sibling adaptation, you know, you just got to, it's a really good read in your book. Maybe just take a peek at that. There's nothing on the test on that. Grandparents, signs and symptoms of potential complications, which is like more like fever, decreased energy level, decreased appetite, you know, that kind of thing, maybe urinary frequency. So again, we want to teach about sexual activity, prescribed medication, routine baby checks, usually within the first week. Moms go to see the doctor between 6 and 8 weeks, depending on whether they had a vaginal delivery. Okay. And then the only other thing is that I want you to look at contraception. Okay. You know, there's no perfect contraception. They all have advantages and disadvantages, and they also change during our lives. Okay. So the one thing that I want you to look at is I want you to know about your contraception. Is it safe? Will I get an STD? And the big thing is that I want you guys to look at in your books, and I'm not going to cover on this video, is, you know, condoms, birth control, the oral contraceptives, okay? As far as, you know, condoms are what, other than abstinence that you guys all got right the other day in class, is, you know, condoms is number one, but, you know, oral contraceptives are good too, but there's people who are at risk for that, and I want you to look at that, okay? Depo-Provera is that shot that we usually give. You give it like every 16 weeks, but there's some breakthrough bleeding with that. But again, you don't really need to know all of that. I want you to really pay attention to oral contraceptives and who might be at risk for that, as well as condoms. And I believe that might be it. That is my notes, folks. So good luck on your test, and contact me if you have any questions. Have a good night.